Good afternoon. Is it on? My ears were stuck up. I couldn't even hear. Good afternoon, everyone. Thanks to my members for being here, so we have a quorum right away. I really appreciate it. And with that, I will call this meeting of the Public Health Committee to, what am I looking for the word? To order. It's been a long day already, and we're just not even halfway through it. All right, and as we move forward, I'll just go ahead and call House Bill 129 and have Representative Sue Hong that will come to present it, one of our new members and one of the governor's floor leaders. So welcome.
Thank you. Thank you, Madam Chair and members of the committee. I am here to present House Bill 129, and just for reference, I am looking at LC 339271-EC.
Does everybody have the right form? Okay, go ahead.
Thank you. Improving the maternal health of women has been a priority for Governor Kemp, and so I'm happy to be carrying this bill on behalf of the governor. What this bill will do is extend eligibility of TANF to pregnant women. As many of you guys know, TANF program is a federal block grant. It exists for low-income families with dependent children by providing cash assistance on a temporary basis, with the primary focus of helping to move families to economic independence through stable employment. The average TANF size, household size in Georgia is about 3 individuals with an average monthly benefit of about $280. This cash assistance is also coupled with work requirement that is required by the federal law. And the TANF program currently is available to families with children 18 years or younger, or if you're a head of household who are 18 years or younger. And now this bill will extend to pregnant women as well. In addition, what this will do is it will take out the requirement that once a family is, if a family is receiving TANF for 10 months, they may not receive any increased cash assistance if another child is born, but we're removing that since it will be extending it to pregnant women at this point. There are statistics and additional information that I can provide, but at this time I will take questions from the members of the committee.
We have questions. Who's it?
And Madam Chair, and I just want the committee to know, I have the TANF State Director here, Jackie Williams, to answer any questions that and any statistics that I may not have here today.
Okay. Thank you for the presentation. Representative Hall?
Thank you, Madam Chair, and thank you, Representative Hong, for presenting this bill. This is a good bill. And I look forward to being confused with you for the next 2 years. I have 2 questions. First question, and maybe you can ask your partner to come if you need these numbers, but what are the qualification criteria for TANF benefits for a family of 3, and how does this compare to the federal poverty level? That's the first question of 2.
And I can speak as far as eligibility, but Ms. Williams, you want to come up real quick and fill in any gaps that I may have. But again, you have to be a citizen. You have to have children that are 18 years or younger.
In terms of the income cutoff, I think is
what you're asking.
Yeah.
So, for example, for a family of 3, so that's a mother with 2 children, you have to have less than $784 a month gross income and less than $1,000 in assets.
Yeah. Representative Al, we started getting off the focus here. You're talking about TANF in general, and we're talking about extending this to pregnant women.
Mm-hmm.
That
just to follow up. So those are the numbers I have too. So just so we can compare these directly. So $784 a month is the equivalent of $9,408 a year. which is quite far below the federal poverty level, which is $23,030 a year. It's about 40% of the federal poverty level. So since we are talking about pregnant women, this is the second part of the question. The goal, as you noted, of extending the TANF benefits to people once they become pregnant is to improve perinatal outcomes, which is something I know that this committee and this body cares deeply about. So the question is, how much effect can we reasonably expect, given that benefits exclude about 60% of families and pregnant people living below the federal poverty level? And also, given that benefits have a lifetime cap, I believe, of 48 months, after which point people cannot reapply for benefits, will there be an extension of that cutoff window, given that we are adding an extra 10 months, since pregnancy is 40 weeks, 10 months at the front end? Are we robbing Peter to pay Paul and excluding benefits later on in a family's livelihood?
Thank you, Representative. The point is not to have people stay on welfare forever. And so that's why we have work requirement programs. Those who can't work will get job training in lieu of work requirement. And so what this bill is focusing on is meeting the needs of pregnant women who do need help, but also during that time, allowing them to have job training so that they can get back on their feet. There is a 48-month cap, and that is staying. And again, we're not trying to have people be eligible for this and then forever be on the program. In addition, once you apply for TANF, it's one application process, so you will be considered for food stamps and any other government benefits out there. And so a lot of people, and correct me if I'm wrong, a lot of those who are currently on TANF, they are also receiving other government assistance that are helping them.
Thank you. This is a good bill. I just want to have the conversation on if it goes far enough to achieve the outcomes that we are talking about. Thank you.
Representative Al, I think as you will remember, we first got for mothers that were pregnant and had had their babies, we extended their care 6 months, and then we got 12 months. Sometimes we do things on an incremental basis down here, and I don't know about you, but any time that we can help pregnant women get a little help from this program and a little more help from that program and get them, we're on a step in the right direction.
I agree.
In a perfect world, we'd start up at the top, but we don't do that always around here. So I appreciate you bringing this bill. I appreciate the governor thinking about this and adding one more addition to helping some of our most needy citizens, especially when they're pregnant. Okay, we've got other questions. Hutchinson, Representative Hutchinson at 2.
Thank you, Mrs. Chair. This question is for your partner. Since there was comments made about people staying on welfare forever, can you tell us the limitations? Because not only is there a 4-year cap since like the 90s, isn't there like they can only get it like 1 year at a time?
No, it's just a 48-month time limit for a lifetime. So generally what happens is when persons apply for TANF, you are put on applicant services. So we try to find you a job up front so you never have to get onto TANF to start accruing months. So with that plan, we're starting with trying to get life skills. It's a lot of other factors in why people don't have employment. It's just not because they don't want to work. So we try in that part of it to enable them to, if they have drug issues, if they have homelessness, try to get all of those things done, and then if they are not successful in finding a job, then they become a recipient. You have to meet your work requirement each month. If you do not meet your work requirement, you can be sanctioned and your case can be closed.
But so theoretically, say a woman receives TANF, she can take those whole 4 years in one chunk?
She could, but that is not our goal. We try to, we have vendors that we send them to help find employment. You know, the way you look for a job today is not the way we look for a job 2 years ago. So we try to be innovative in helping them to find employment. The goal is for them to find employment. And even once they find employment, we have the work support program, which allows them to get a stipend for a year for $200. They'll get their extended child care. Their food stamps are frozen at the amount that they were getting prior to employment. We also will pay for support services such as if they need uniforms for work, or if they have a vehicle and the vehicle needs a set of tires. We do all of those support services so that they will not have to come back to TANF again.
And to your knowledge, how long have we had work requirements in place?
90s, I can't, yeah, it's the 90s, but I can't give an exact
So
date.
the point is, nobody has been on welfare for a long time,
Right. Well, what happens in those cases where persons are on their 48 months, they do a staffing. And if they have circumstances, you have vocational rehab persons. You have persons that are, their children, I'm just going to use autism because that's a big thing now. And they still have children that are fitting, into that 18 age range. We do have hardship staffings that will allow some people to stay on. So it's just, but we very rarely have those staffings now. The 48-month staff, and I'm sorry I don't have a number for you right now of how many people have reached 48 months, but it's not been very many.
I worked for DFACS during the 90s, so I remember when that law was passed. And it seems like even today, there's this myth that people can be on welfare forever.
No.
And that just doesn't happen. And it hasn't since the 90s.
No, and you must meet your work requirements monthly, so they are not just sitting there. They have to, have staffings. If they do not meet, they have a staffing to see what the issues are, to see if it's something that we can handle, or sometimes it's just that they don't want to do it. So those cases are sanctioned and closed.
Thank you.
Representative Lott.
Madam Chair, can I just, Madam Chair, can I add a little bit to that? Madam Chair, and the work requirement is a federal work requirement, and so in order for states to be eligible to receive TANF, each state has to show that work requirements are being met as well.
And the participation rate has to be at 50% for us to be meeting the federal level.
Thank you.
Okay. Representative Chokas, sorry, we had the wrong.
Thank you, Madam Chair. At the appropriate time,
Okay, I will recognize you. At the appropriate time, we have more questions. Representative Oliver.
Thank you. I'm looking at line 63, which seems to be the guts of this bill. Right now, a parent with one child is entitled to TANF if they make less than $9,000. And what this bill does is it allows a pregnant woman who doesn't have any other children to be eligible for TANF. Is that the gist of it?
That's correct.
And how many families receive TANF today?
Give me 1 second. So as of December 2022, in Georgia, there are 5,343 cases. They're broken down, so approximately 4,800 of those cases are child-only cases, which means they're 18 or younger, or grandparents that are taking care of children. And then approximately 479 with adults receiving benefits.
And that's a staggering low figure. 400 parents and children are getting TANF today. How many new eligible pregnant women will be added in your estimation if this bill passes?
We do not have that figure. I mean, just as far as nature of pregnancies, it's a always changing number. But certainly, I believe the department will be.
Yes, we don't keep those statistics because we were not working with pregnant women. Pregnant women today can apply 45 days prior to the birth of the child because it's a 45-day process. That was the process I was speaking to earlier about the applicant process. So a pregnant woman can apply 45 days prior as of now.
And you don't know how many of those are. It's just interesting to me how few women are going to be covered by this. 500 in Georgia? I'm just
Those are
curious.
Those are our mandatory participants that have to meet that work requirement. That's the 500 number that she's speaking about.
I'm supporting this, but I'm just trying to figure out the numbers. Thank you.
And it may be more numbers when persons find out about it. Right now, it's not something that they can do, but I'm sure that if it passes, more women would take advantage of it. Because what happens now, if someone is pregnant, they can also do the work requirement. And some of the pregnant women do while they're pregnant. They'll go to a provider that will help them get their resume together, interview skills, and so forth. So when they have the baby, they do, stay out the proper time that they can heal, and then they're ready to look for work. And they don't have to start at the point of after they have the baby. They're already ready for work.
Okay, and I have a question just for clarification. How do they know about this? And how do we get that word out to more mothers about it? Can you tell me that again? So how mothers in need, how will they learn about this? I mean, they're already coming to you for TANF, or they were already on it, or how do we let them know? That's one of my problems I've had with state government, assistance at other places, that people don't really know that it's there when it's needed.
I'm sure we would have it on our website, and we have our Gateway program that you can apply from home. Also, I could see us working very closely with WIC, because most of those mothers are going to go to WIC to get those supplements that they can get from WIC, including, prenatal and after the baby is born. So I see us working very closely.
Right, okay, and that is a really good, that's one of the things that we're looking at with this new committee that we have of looking at healthcare and making it more coordinated. Okay, how hard will it be if they apply for WIC? Will they automatic, if they learn about it there, be able to sign up for it, or is there another very involved process to get it, or how do we make that more?
Right now, you can apply for all of those at one time through Georgia Gateway. If you go into Georgia Gateway, that mother could apply for TANF, food stamp, Medicaid, and WIC at the same time. It's just one application.
Well, this is going out, to people across the Georgia that are listening to it, and that's what I'm trying to get. So by just going out to Georgia Gateway, okay, that a pregnant woman can learn about all of these places that they can go to get assistance if they need it.
Correct.
Okay, without multiple involved application problems. Okay, that's what I was on to make sure that they weren't going to have to go by some involved, long and lengthy application process for this and then for one of the other ones. Okay, we've shortened that and we're making it more available and easy for people to use.
Correct.
Okay, and I thank you for that, because it hasn't always, like getting the children afterwards signed up to, our Peach Care program. And so when they've needed food stamps, and now, if you get food stamps, your children get signed up for Peach Care, which they need. That's something new we did last year. So,
and with the WIC program as well, that mother is getting extra, because the monies that she could still save from her food stamps, she would be using with the WIC as well, because they get vegetables, they get the milk, they get cheeses and so forth, that could also help that budget a little better with food.
okay, thank you. Okay, who was it? Okay, any other questions from the committee? Did you get to ask your question? No, go ahead and ask your question, Representative Chokas.
Okay. Madam Chair, I'd like to move do pass for House Bill 129, LC 339271 EC.
Okay, we have a motion of due pass, and we have a second. Okay, I'm going to use this time to ask, we have two people that want to speak to this as far as it may bring up discussion. Mr. Floyd or Ms. Floyd. Tell us who you're with.
Hi, my name is Ife Finch Floyd, and I am with the Georgia Budget and Policy Institute, and I want to say thank you to the committee and Madam Chair for, and Representative Hong for bringing this legislation. We are definitely in support of it to make these small changes to TANF, but I did want to raise a couple of points that I think Representative Al was referencing, is that the program does need to be reconsidered and updated. So those benefits, they're about $155 for a family of one. For a family of three, the maximum benefit is about $280 a month. And those haven't been changed for more than 30 years, right? So they've lost a lot of value. And for, a mother who's trying to, raise a new baby, that we know that's not going to go far enough, even with SNAP benefits. And then there are asset tests that may be a barrier or a hurdle for some folks. And I think I kind of keep hearing different information, and maybe the state can clarify if those asset tests are being implemented or not, but they could be a hurdle for some folks. They might have to be absolutely destitute before actually accessing the program. And finally, on the work requirements, those work requirements can be rather strict, but I think what we also see in the research is that they could help people find jobs, right? But those jobs might not be the kind of quality jobs that really help people exit poverty and find stability. So I think really this opens a conversation around the program to continue to think about how we can improve it. But I'm certainly in support of this bill. These are good steps in the right direction, and thank you so much.
I will tell you, Ms. Floyd, I think that the fact that the standards are 30 years old, that not at this time is for us to decide if they do need to be revisited. I agree with you on that. But on the work requirements, an entry-level job is better than no job at all. And through our technical system, we have a lot of programs where you can start off and then you can take hopefully work your way up, take another free course at our technical system, like from certified nursing assistant to then the LPN program where the tuitions are free, to begin to work their way up the system. I know it's hard. I worked my way through school, and it's not easy, and I certainly had advantages that I think that many people don't have, but it's a start. And so...
Absolutely. I would just note for people who are experiencing extreme poverty with a baby, some things that might be easy for us may be really difficult for those families and those women. And I just want to note the state does have options, right, and some flexibilities. Like, for example, there are some exemptions that the state could consider for those who work or training at the moment may not be the best for them. Some states have, for example, exemptions for parents with infants or pregnant persons to exempt them from those work requirements if they feel like it's going to be an undue burden on them. So I just wanted to offer that into the space as well. And again, I would love to just continue the conversation about how to improve the program to make it better for families in poverty.
Okay, Representative Al, do you have a question for the presenter?
Sure. Just as a follow-up in the spirit of continuing this conversation about how we can update a little bit of this formula, here's the question. We're talking about the 30 hours a week work requirement, and the qualifications for a family of three is, we calculated out to about $9,408 a year. So to have a job where you are working, making less than $9,408 a year, yet being out of the home for the work requirement for 30 hours a week and not taking into consideration childcare costs seems like a part of the formula that we need to look at updating. What are your thoughts on that?
So again, some of this gets into the technical pieces of it, and perhaps Ms. Williams can talk about it. But I think some of the hour requirements for if you have a very young child might be slightly different. So maybe Ms. Williams can speak on that. So it could vary, right? But certainly from GBPI's perspective, that's right. Like it could be a big challenge to have to meet the requirements, work, right? And then also just handle all your parental responsibilities. It could be just a big challenge for people who have a lot of other challenges in their life.
Representative Houston.
Parliamentary inquiry. Aren't we trying to decide whether pregnant women should get TANF money or not? I think we're sort of off track, and this might be for another discussion. I appreciate your comments, but there are a lot of other meetings we have to go to
Right.
too.
So, thank you.
Thank you.
And briefly, Callan Wells. And of course, you now have gotten the message to stay on topic about TANF. I think I added to that, Representative Houston, so sorry.
Hi, everyone. I'm Callan Wells with GEARS, the Georgia Early Education Alliance for Ready Students, and we are in support of this bill, but also think of it as the start of a conversation about reimagining what it could look like.
Thank you.
Thanks.
All right. Any other conversation from the committee? What? Who we got? Who's first? Representative Fry.
Thank you, Madam Chair. Representative Houston, if I may. What was the total amount that they needed to make, that you're saying they make? Representative Ball, was that like 9,600 and something, right? Real quick.
Family of 3, the qualifications are less than $784 a month, is that correct? Which when you calculate it out, if you calculate 52 weeks worked a year, is $9,408 a year annual income has to earn below that with a
Thank you.
30-hour week work requirement.
So if you have a 30-hour-a-week work requirement with that maximum amount of cash, that's below minimum wage. Just want to point that out. So I appreciate the opportunity to have these conversations at a later date, but this whole system is broken. Also, thank you, fellow representatives, for pointing out the system is not used by a zillion people. We've got 11 million people in the state of Georgia, and they're not all on welfare with the lowest unemployment rate that we've seen in 60 some odd years. This is important information. I appreciate the chairwoman humoring us for that info. Thank you.
You're welcome. I'm going to call the question. Everybody in favor of the passage of House Bill 129, say aye. Aye. Anyone opposed? No. The ayes have it. Thank you very much for bringing it to us, Ms. Hong. And thank you for coming and for the work that you do with our families in need. Okay, next, Danny Mathis and Representative Mathis, and it's House Bill 143. I don't know where to get so far off.
Yeah, thank you, Madam Chair. I'm here to bring you House Bill 143, LC 339290.
The correct bill?
Got that? All right, what this bill is continuous glucose monitors that's covered under Medicaid. What we'd like to do is change that from a medical benefit to a pharmacy benefit for this reason. It's where people can get the monitor and place them themselves. These monitors are continuous and can be monitored with your cell phone, and it will help people monitor their blood sugar better. The monitoring system is fairly simple. These glucose monitors are placed either on your arm or on your stomach. They are checked by your phone, and the reason that would be good to go from the medical to the pharmacy is that more people have access to it through a general practitioner, rather than having to go through some endocrinologist, through a medical part, the pharmacy part, that they can get access to them easier. And the goal here is to help people lower their blood sugars or keep their blood sugars at a level where they don't go in hypoglycemia. That is a serious issue. I have a personal issue in this bill for the simple reason that I have a son that's been a type 1 juvenile diabetic since he was 11 years old. He's now 40. And so I know what the horrors are when they have a low blood sugar. That can cause death. And high blood sugars are bad, but they're not as bad as a low blood sugar. So when we have this access to these people that don't live in a situation where they can have an endocrinologist, because I was astonished when I was talking to folks about this, that there's only about 65 endocrinologists in our state. And you know, we have a lot of rural counties, and I live in a rural county, but I do live close to Macon, and my son's able to go and see an endocrinologist. But there's so many people that don't. So if a general practitioner can offer this to them, they can monitor blood sugars better. And for a parent that has a child under these circumstances, that would be huge. I remember having to go up and check on my son during the night to make sure he was okay in his sleep. This would give them the access to be able to get a reading, understand what they might need to do to help them. So I see where this is going to be a great benefit to save lives and to save people from complications. This is the next thing of the bill that I thought was good. I believe if we can get these folks, they have. If you look at the bill, it had some parameters where they have to be checked. They have to maintain a certain level of what their type, you know, how they have the rate of hypoglycemia they have, that sort of thing. So it's not like we're just putting this on every person that's been diagnosed diabetic. It's the people that have the issues where hypoglycemia is a terrible thing for them and can cause death. Not only is it going to help save lives, but it's going to help people, hopefully, to manage their blood sugars better. Because when they're aware that they have a low or a high blood sugar, they're going to take the medication that they need. And when they take that medication, they stay in a better, healthier condition. But they're going to be able to use a general practitioner that can administer this glucose monitor. And I think that'll be helpful because it'll be in rural areas of the state. And yes, we are going to increase the number of folks that will be doing it, but here's what we hope happens. That we're going to lower the cost by them being able to monitor themselves. Is going to be less time they have to go to an emergency room or be hospitalized. And another thing that we added to it, even on an ambulance call. I know as an EMT in my first years, and I know Representative Seabaugh, he understands, we go out on calls with people with low blood sugar and we get their blood sugar back up and then they don't want to go to the hospital. But you still are going to be charged with an ambulance trip to come there. So we got threefold here what I think we need to try to do. So number one, we're going to save lives. We're going to help people take better care of themselves, and we're going to be good steward of the money that we're giving these folks to do this. So what I'm hoping that this bill does is that we can do all those things, and we're going to meet the standards, the same standards as commercial plans already do 90% of it. So we're going to keep folks that are on Medicaid. They're going to be able to, if they have an elderly parent that lives with them, that's a diabetic, they can better monitor their glucose with that. If they have a child, like playing ball. I had a good friend of mine tell me about this the other day. Their child plays ball, but they'll be at the ball game, and if he gets low blood sugar, the monitor from the daddy goes off, the phone, and he can make sure that child doesn't have an episode. So that's a threefold thing that I think is great. Number one, it's going to better help them control their blood sugars and can save their lives. It's going to, I believe, save money, and it's just going to give people peace of mind that they have this. Because I think it said we can have up to 10 people on the phones that can take these monitors. I know my son does that, and his will go off, and it's a very scary thing if you've ever seen anyone have a low blood sugar. It's a very traumatic thing. So I hope this is a good bill. I'm going to keep it right there. If you have any questions, I'll try to answer them for you. If I don't, I have a little help here. So I'll be ready for any questions, Madam Chair.
I have questions.
Yes, ma'am.
Quite a few. Let's keep them, let's make Representative Houston happy and keep them succinct. Smile, Penny. Thank you very much. So she's new to the committee. Sometimes we can talk things. Well, get ready. Get ready. We discuss a lot of times in great detail on this health committee. Representative Reese, I'm glad to have you on the health committee.
I'm glad you're here, Ms. Penny.
Thank you, Madam Chairwoman. At the appropriate time, I would like to move this. But I also want to say thank you, Representative Mathis, for this bill here. The American Diabetes Association states that roughly 12% of African Americans are impacted by diabetes, and that's roughly about 7.5% for whites and a little over 9% for Asians. And it's more of a genetic trait for African Americans. And as an eighth grade, I was in eighth grade, my great aunt, who was a big caregiver in my family, I watched her have both of her legs amputated and ulcers grow on her leg because she was a very bad diabetic. And unfortunately, we didn't have many financial means. I'm the first in my family to go to college. And something like this, even though technology has caught up where we can do this, just would have been so beneficial. And I know it's going to be extremely beneficial in the African American community, especially now that so many of us are walking around with cell phones. And to have this thing to be able to monitor for us what's going on health-wise, I just support this 100%, and I'm glad you brought it. I'm glad to be able to sign on the bill as well. Just want to say that. Thank you, Madam Chair.
Thank you. Representative Stoner.
Thank you, Madam Chair. And I'm glad to be here on health. Thank you very much. I agree.
No, I'm teasing. I know
I understand. No,
I know
understand.
your family has been very involved from personal reasons and as a community in helping young people that are diagnosed with type 1 diabetes and all to deal with their diseases. So I appreciate that.
No, thank you, Madam Chair, for that recognition. And to that point, everything you've stated, Representative Mathis, is something we've talked about for years, and this makes total sense. And beyond just, obviously individual lives, if we just want to talk about the economics for the state, this is going to eventually save us money because you're avoiding a lot of the issues that unfortunately come with unmanaged diabetes. And, my wife's a type 1. That's the reference the chair was making too. And we've been sponsors of Type 1 Day. Now, there's more than just Type 1. There's Type 2. I'm actually a Type 2. And in fact, I wear a CGM. I actually check my glucose right now and do all that. And I had lunch. I'm at 177. But the fact that I have this ability, and by the way, I get this under our state health care plan and everything. So I'm glad to see what we're doing on this situation under Medicaid. So again, glad to be a co-sponsor, glad to see this, and anything I do to help move this through. Thank you, Mr.
Thank you. Representative Bennett.
Thank you, Madam Chair, and glad to be on health. And thank you, Representative Mathis, for bringing this great bill. I have two questions. One, the bill does not specify type 1 diabetes, and we also know that type 2 is equally as important. It also, when you speak about, or it covers hypoglycemia. Is there an opportunity to include hyperglycemia and put some parameters into there?
Well, your second question, when I referred to hypo and hyper, I was saying hypo is more critical to someone. If they have a low blood sugar, they can pass out, they could hurt themselves, head injury, break something if they're elderly, and that type of thing, and they can end up dying from that. You can die from hyper, but it's got to be grossly. It's not as prevalent. You understand? I mean, people, a little bit of high blood sugar, is better than a extreme low blood sugar. So it covers both. But I think in the bill, it gives the parameters of, people that have different types of, you can have type 1 or type 2 and be eligible, if I'm not mistaken on that. But you have to read what they have to do is they have to go back in every few weeks, and they have to make sure that they are tested by the general practitioner, so people that don't live around an endocrinologist can have this opportunity to get this glucose monitor, if I understand. And if you'll repeat the first question again,
Follow
I'm a
up,
little
Madam
slow.
Chair. May I follow up? And I know you mentioned that we do things in increments here. When I look at line 21, 23, 26, all of the references in this bill refers to hypo, and I do appreciate your explanation of that and your personal involvement there. However, if there can also be some consideration, and there are statistics that also talk about hyperglycemia, which is equally as devastating and costly to the state. If there's an opportunity at some point, Madam Chair, either to work with the author of this bill to include hyper, or to come back and do something to complement it.
Representative Bennett, I think it's already covered because this machine, if
Yeah.
Representative Stoner had gone out and had a triple sundae with all the wonderful toppings they have for them after eating a huge meal full of starches, we would have seen on the monitor already maybe a 300 or more blood sugar, which then would have alerted his wife, and if he was a child, it would have alerted the parents to the fact that the blood sugar was running that high. It would also be recorded so that the physician, when they look back over, 2 or 3 or the 3-month interval, would show that physician what it had been running, and so it is already covered.
Yeah, on line 20 there, it's treated with at least 1 daily administration of the insulin. So if anyone is taking insulin, they're going to be under this. Yes, ma'am.
Thank you. I just don't want the
I understand
confusion
that. Yeah, gotcha.
to be so heavily stipulated that only if you have hypoglycemia you'll be eligible to receive this benefit. Thank you, Madam Chair. We can talk about that.
Do you want to ask me that first question again, or I
No.
forgot? You good?
Get together
Thank you, Madam
after
Chair.
the
I'm
meeting
good.
if they want that. I'm getting a list, 9. Okay, Representative Burkle.
Oh, thank you, Madam Chair. And to Chair Lady Houston, I'm also very new to this. And I will ask my question very briefly, and it's my intent. Representative Owl was talking about being confused with Representative Hung for the next couple of years, which is not a bad either way, but yesterday I was confused with Chairman Knight. So it's taken me 1 minute in order to
That's not unusual.
to get to the point of my question. So on line 33 through 36, Representative Mathis, so every 6 months following the initial prescription, you should have an in-person or a telehealth visit with a physician. Compliance is a difficult thing. So if I get the end of the thing, how about if I don't show up? Like I say, I'm new on this committee, and I don't know anything about healthcare, but I do know that people, as a general rule, a lot of times don't show up. And so if I don't show up after 6 months, will I not get the strip anymore? Is this part of the mandatory type? I just don't know what happens.
Well, I understand it. I think the reason they have to go back, number one, is they check to make sure everything's okay, functioning right, because you do have to change these things every 10 or 12 days. It's not like you just put one on and that's it. You do have to update them. Now, I'm going to refer to my help behind me on the part if they don't comply to what's here. Do y'all have an answer for that? If they don't comply to the 6 months? Yeah.
And our client on this is Dexcom, who makes continuous glucose monitors. I'll just say that the idea here is that you need to be sure that the CGM is a fit for the particular patient, and if not, there is the ability to say this isn't working, but it's designed to be a guardrail on just fitting the device with the patient, and that the patient is going to do it. And you'd share, Representative, I'll invite you to share with your experience with your son. There's other things you have to do to take care of and manage diabetes, and this is one part of it, but this is part of just making sure that this is the right fit for the patient that would receive it. And it is part of the national standards to have the checkup every 6 months. So this is also at the national level.
Okay, and I understand. So if it's part of the national standards, I understand. But I feel like I give my physician enough money, and if this is just to check back in, but if there is actual use, I just, thank you.
Well, to answer a little bit to that question, the monitoring and taking insulin is just a part of the diabetic regimen. If you don't eat right, and if you don't do the exercise and you do the things, you can't just sit in a chair and monitor and take insulin and defeat diabetes. I mean, it's just that part of it. It's a combination of things. And I think one thing, Chairman Buckley, is that they go back and if they see that they're not, but I understand exactly what your question was. So,
And
thank you.
also, Representative, I think this is a Medicaid. There is some personal responsibility that needs to be taken.
Mhm.
These are not cheap. And if they're not using the system, if they don't, change it out and get a new one when they need to,
That's right.
if they are, just going off their, diet all the time and still having to call emergency for emergency care because, it's dropped really low, basically, they might as well go back just to using insulin shots and supposedly stick in their fingers than a system. So having been married to a person that worked a great deal with people on insulin and all, it's just, you need to put some kind of parameters that there is some personal responsibility in this, that it is costing the state more money than just regular insulin. And it's certainly better, and we work toward improving, than what most physicians used to do that didn't understand diabetes. They would tell people to lose weight, and if they didn't lose weight, they'd say, I'm going to put you on insulin, and if they didn't lose weight, they put them on insulin. So this is just a new mechanism for our Medicaid patients of trying to learn a better way to handle their diabetes. So, and I would imagine that most physicians are going to really keep up in this and keep trying longer than just that one time if they don't show up, but to get rechecked. But if they don't get rechecked, it's one of the reasons that we are having such a cost care to Medicaid. Representative Al.
Thank you. Quick question. Isn't it true that continuous glucometry has come to become the standard of care for diabetic patients?
Yes, ma'am.
That's all I need to know.
Representative Howard.
Thank you, Madam Chairman. I've heard this word several times, this idea of increments, even with 129, and I think this is probably a good start, a good incremental start, but I don't know if it addresses our major issue, especially when we are confining this just to Medicaid patients. I would not qualify for that monitor being a diabetic. But with a family history, I can say that this idea, the monitor is excellent. I did it for about 3 months, and it helped me out a lot. And I think the biggest savings on this is, to me, it's preventive care. It helps cost, it helps, medical visits and whatever. So I like the idea, but hopefully we'll reconvene at some point and address this in a broader sense, that it can be of greater savings to another community.
Representative Stoner tells me that it is paid for on the state health benefit plan. That still lives insurance companies that be out there, and everybody knows I like to go after the insurance companies when they're not providing good patient care. So you're like, we can move forward. Representative Oliver.
Paragraphs B and C both set out kind of standards of care, medical standards of care. When we pass other bills, I'm happy to be on the health care committee too, and I don't know the answer to this. When we pass other bills, do we set standards of care in the statute? We do. Okay. Thank you.
Are there any other questions from the committee? All right. Okay, guys, just because I asked, don't start all the lights going. Hold on a second. Okay, all right, okay. Representative Reese, you want to go ahead and make the motion?
Yes, Madam Chair, I recommend a due pass for House Bill 143, also LC 33920, presented by the gentleman from the 149th, Representative Mathis.
Okay, we got a due pass and a second. Is there further discussion from committee members? No, we got a second. Okay, but we'll take yours too. So, okay, is there anybody in the audience that wants to make a comment about it? Take your chances. No. Okay. Great. Okay. Everyone in favor of the passage to House Bill LC 339290, say aye. Aye. Anyone opposed, say no. Okay, we got it. The ayes have it. Okay, one more. I'm going to do this really fast. You know, we do all sorts of honoring different groups and designating a certain day, and this bill is mine. It's House Resolution 95. It's for hypertrophic cardiomyopathy. It is a chronic disease involving a thickening of the heart muscle. It can cause minor symptoms, shortness in breath, others two symptoms that will lead to death. And we are asking the governor to designate a certain day as Hypertrophic Cardiomyopathy Day, Awareness Day, and for us to look and promote awareness of this illness. Are there any questions? And if I get any really technical ones, I'm going to ask Representative Howe to answer them. No. I think I know. I probably could answer them, maybe. So anyway. All right. Who we got? Oh, Chokas. What can I do? Representative Chokas. No.
Madam Chair.
Yes,
I've
sir.
been on this committee and proud to serve on this committee since the first day I was at the House. And if at the appropriate time, I'd like to do pass for this resolution.
This is appropriate times.
All right,
Like
do
that.
pass
There you go.
House Resolution 95 LC 339280.
We've already had that, and we had a second for it. So technically, you just get to add to that, and so now's the time to vote. Everyone in the favor of the passage of House Resolution 95, say aye.
Aye.
Anyone opposed, say no. The ayes have it. Before we adjourn, I can tell, welcome to everybody that's new. I can tell this is going to be a fun committee and may even confuse me to where we are in the process at times, just like now. But I am glad to have all of you here. And I know that we all together can work for passing good legislation for improving health care for Georgians. Thank you very much. We are at ease. And